It was a normal night. I was going to bed, and when I laid down, my heart was racing, like racing. And I thought, what is happening here? I started to feel like an ache. There was discomfort shooting down my arm. I thought, am I having a heart attack? I literally didn't sleep all night. When I got to the ER, I still wasn't feeling good, but I was also feeling a bit nervous. Finally, probably after 3 hours, the doctor came back and said, CAT scan's not showing anything. I can't see a clot anywhere. I can't see any blockage in your arteries. He says, you should be followed up by your family doctor. I'll give you discharge papers. I still had discomfort in my chest area around my heart. It's like somebody squeezing my heart. I'm nervous, like, have they missed something? It was scary, yeah.
To someone who knows my mom quite well, knows that she doesn't over-exaggerate her symptoms, so I knew that they were serious, so it was frustrating to feel like they weren't being taken seriously.
My GP sent a referral in and got me in to UBC for a stress test, and a few weeks later. That was probably the most dramatic day I've ever had in my life. The doctor, he said, your stress test is very irregular. You may have a blockage. It could be a blood clot. The cardiologist comes in with a nurse and basically says, you know, the good news is your arteries look really good and your heart muscle looks super good. So he said, do you think you maybe are having anxiety attacks? I looked at him and I said, no, this is physiological.
My mom really had to be an advocate for herself because people weren't listening to her and they weren't believing her when she was saying that something was seriously wrong.
I felt like I was in a time bomb. Like, if we don't get this figured out, how much danger am I in? My GP was like, we are going to get you in to see a cardiologist.
Heart disease is the #1 killer in women in Canada, and the traditional cause of heart disease in men and women was felt to be blockages or cholesterol plaque in the arteries surrounding our heart. And it turns out that in men, over 90 to 95% of the time, that's true. But actually in women, only 80 to 90% of the time, that's actually true. The women still had the heart attack, but it's actually a different cause. And those causes can be that it's not the big blood vessels that surrounding the heart, it's actually the tiny micro blood vessels.
I was so relieved that she believed me. It was very clear from the beginning that we were a team in this.
Even though she had the normal angiogram, I said to her, you know what, I still think this is cardiac. And so now we need to go ahead and we need to look for some of these more difficult to diagnose entities. We did some testing, such as an MRI and some other non-invasive tests, and actually determined that she had small blood vessel disease or microvascular coronary dysfunction. So literally the small, tiny blood vessels of the heart become dysfunctional. They either become blocked up with cholesterol, they spasm down, the blood flow in them is limited, and that actually creates chest pain because you're getting a lack of oxygen to the heart. And it gives you very similar symptoms to as if you were having a big blood vessel problem.
She said the good news is it's not life-threatening, but if you don't get proper blood flow, not only being uncomfortable, it can cause damage to your heart over time. So we need to treat it.
There was a huge sense of relief that we now knew what the diagnosis was, and Dr. Sedlak was confident and that she would be able to help and provide treatment going forward. And obviously having a cardiologist who is so accomplished and who focuses on women's heart health was a huge comfort. I'm very grateful to Dr. Sedlak and everybody at the VGH team who's really supported my mom throughout this whole journey.
I would say that we're one of the most well-known programs across Canada, and women are excited that they want to come to a program that's about them, that really hones in on some of these unique differences between men and women. Since 10 years ago, when I first was interested in women with heart disease and we were misdiagnosing women with heart attacks, nowadays we're better at diagnosing. We're just better at recognizing what are the risk factors. We're better at recognizing that even if a woman presents with a heart attack and has a normal angiogram and has normal blood vessels, that there are other causes of a heart attack, such as small blood vessel disease or dissections or tears in the arteries. Philanthropy is extremely important to be able to set up exciting women's heart health centers like we have here in Vancouver, but also on the research level. Without philanthropy, we really wouldn't be able to make that kind of research happen.
After 8 years since the initial diagnosis, with Dr. Sedlak's medical expertise and her care for me as a patient, I've been able to manage my heart disease with the medications, with exercise, with diet, and with the heart healthy classes, which have been really beneficial to give me my life back. And that's something that, is an incredible gift to me. Thank you so much for supporting VGH and UBC Hospital Foundation.